So question here, the doctor has ordered 80 milligram of furosemide. Other name of furosemide is the Lasix. It is diuretics. So 2 times per day. So the nurse note the patient's potassium level is 2.5 milligram milliequivalent per liter. So the key point is here. So the furosemide or Lasix, it is the diuretics. When my patient need to take furosemide or diuretics, we always check the electrolyte because furosemide can cause electrolyte imbalance. And the nurse note patient potassium level 2.5 milliequivalent. So this is not normal range. Normal potassium level 3.5 to 5.5 milliequivalent per liter. So it is less. So the nurse should do what? Number A, admin Lasix is ordered, admin half dose, offer the patient a potassium-rich food, and withhold the drugs and call to the doctor. So don't forget, we are RN, registered nurse, or we are LPN. So I do not have right to reduce the doses, half of the dose. Administer the Lasix as order is not a good idea because potassium level is so less. Offer the patient potassium-rich food. Definitely it is good choice, but it is not the first option. First option, I have to withdraw and also notify to the doctor, right? Then doctor can decide what should do. So the correct answer is number D, withhold the drugs and call the doctor. Because potassium level 2.5 milliequivalent per liter is extremely low. The normal, as I told, the normal potassium level 3.5 to 5.5 milliequivalent per liter, and Lasix or furosemide is a non-potassium sparing diuretics. So the answer A is incorrect. The nurse cannot alter the doctor's order, right? So answer B is not correct. Answer C will not help with the situation like this. Next question. Which of the following lab studies should be done periodically if the client is taking warfarin sodium? Following lab study, periodically client taking warfarin. Other name of warfarin is called Coumadin. So warfarin is a blood thinner, right? So number A, stool specimen for focal blood. Number B, white blood cell count. Number C, blood glucose. And number D, erythrocyte count. So the correct answer is A, means stool specimen for focal blood is the answer. And focal blood test should be done periodically to detect any bleeding on the client who take the Coumadin or warfarin therapy. So answer B, C, and D are not directly related to these questions. Next, go. The client has an order for heparin. Heparin is a blood thinner to prevent post-surgical combine formation. Immediately following heparin injections, the nurse should do what? Number one, aspirate for the blood, check the pulse rate. Number C, massage the site and also check the site for bleeding. So correct answer is check the site for the bleeding, right? Why we chose this answer? Because you see immediately. So the keyword every student must find out to get the correct answer. Immediately following. So after admin or after administering any subcutaneous anticoagulant, the nurse should check the site for bleeding. The answer A, C are incorrect because aspirating and massage at the site are not done. And checking the pulse is not necessary, is right, because there's the heparin. And next question goes, the client with AIDS, right, AIDS, tell the nurse that he has been using acupunctures to help with his pain. And the nurse should question the client regarding this treatment because acupuncture uses for what? So at number A, pressure from fingers and hands to stimulate the energy point in the body. Number B, oils extracted from plants and herbs. Number C, needle to stimulate certain points on the body to treat the pain. So they said the nurse should question client regarding the treatment because pressure from the finger and hand to stimulate the energy point in the body. Number B, they said oil extracted from the plants and herbs. Number C, needle to stimulate certain points on the body to treat the pain. Number D, manipulations of the skeletal muscle to receive the stress and pain. The correct answer is number C, right? Needle to stimulate the certain point to the body to treat the pain. So, first of all, why it is the answer? Need to stimulate. So, acupuncture uses the needle, and because HIV is treated by blood and body fluid, so the nurse should question this statement. So the client with HIV tell the nurse that has been acupuncture to help this pain. The nurse should question the client regarding this treatment because a patient need to put the needle to stimulate the certain point on the body and treat. But when question come out the needle and patient has a HIV or AIDS, this is dangerous. So let me recap it. Acupuncture uses the needle. And because patient has a HIV and AIDS is transmitted by blood and body fluid. So the nurse should question this treatment and answer A, describe the acupuncture. And answer B or answer D, describe the massage therapy with the use of the well, not for acupuncture therapy. Question here, the nurse is taking the vital signs of a client admitted with cancer of the pancreas. The nurse is aware that the fifth vital sign is This type of question frequently asked in Nclex board. A, anorexia, B, pain, C, insomnia, and D, the fatigue. So every student know there are 4 vital signs: blood pressure, respiratory rate, pulse rate, and temperature. So what next? The next one is a pain. So answer is a pain. And pain is the 5th vital sign. So the 5th vital sign is pain. The nurse should assess and record the pain just as they would measurement the temperature, respiratory rate, pulse rate, and blood pressure. So answer A, answer C, or D included in the patient charting, but are not considered to be the 5th vital sign, and are therefore it is incorrect. Answer B is correct. Next question goes to here. 84 years old male has returning from recovery room following a total hip repairment. He complained of pain and is medicated with morphine sulfate and promethazine. Which medication should be kept available for the client being treated with opioid analgesia? So question: recovery from following hip repair. So patient has a pain. Because of pain, we give them morphine and promethazine. Which medication should keep available for the client being treated with opioid? So if any overdose occur, we need the antidote. So you have to find out what is the antidote of opioid, like naloxone, ketorolac. Ketorolac is a pain medication. Acetylcysteine or aspirin, also atropine sulfate or atropine. So the correct answer is A, right? Naloxone. So naloxone is the antidote for opioid analgesia. What is opioid? Morphine, pethidine, meperidine. All together is called opioid, and naloxone is an antidote. And here, toradol or ketorolac is a non-opioid analgesic. It is also pain medication, but non-opioid. Aspirin, or chemical name is called acetylsalicylic acid. It is the simple is an analgesic. Anticoagulant and antipyretics property. Aspirin has anticoagulant property, antipyretics properties, and also pain reducer. Atropine, here, number D, is a anticholinergic drugs. Next, the doctor has ordered a patient controlled analgesics. It is called PCA pump, important for Nclex board exam. What is PCA pump? It stands for patient controlled analgesia. So patient can regulate how much dose they need, because patient can feel their pain. They can complain about their pain. You do not feel it. Patient can feel it. For the client with chronic pain, the client asks the nurse if he can become overdoses with the pain medications using this machine. The nurse demonstrate understanding of the PCA if she stayed for. So there are 4 options. The machine will admit only the amount that you need to control your pain without any action from you. Number B, machine has locking device that prevent overdose. Number C, machine will admit 1 large dose every 4 hours to relieve the acute pain. Number D, machine is set to deliver medication only if you need it. So the correct answer is number B, right? So the machine has locking device that prevent the overdose. So the client is concerned about the overdosing himself. The machine will deliver a set amount as ordered and allow the client to self-admit a small amount of medication. And PCA pump usually are set to lock out the amount of medication that the client can give himself at 5 to 15 minute interval. So the answer D does not address the client concerned, right? And so the correct answer is number B. Next question here. The doctor has ordered transcutaneous electrical nerve stimulations, shortly called TENS. Very important for Nclex board. TENS and PCA, the previous question, important for Nclex board exam. So, unit for the client with chronic back pain. The nurse teaching the client with a TENS unit should tell the client, if you may be electrocuted if you use water with this unit. Number B, please report the skin irritations to the doctor. Number C, unit may be used anywhere on the body without fear of adverse reactions. A cream should be applied to the skin before applying the unit. So the correct answer is B, right? So please report the skin irritation to the doctor. So skin irritations can occur if TENS, transcutaneous electrical nerve stimulus unit, is used for prolonged period of time. To prevent the skin irritations, the client should change the locations of the electrode often. Electrocutions is not a risk because it uses a battery pack. Thus, answer A is incorrect. Answer C is incorrect because the unit should not be used on sensitive area of the body. And answer D is incorrect because no cream are to be used with this device. What next? So the nurse asks the client if he has an advanced directives, right? The reason for asking the client this question is, number A, she is curious about his plan regarding the funeral arrangement. Number B, much confusions can occur with the client family if he does not have a advanced directives. Number C, an advanced directives allow the medical personnel to make a decision for the client. And number D, an advanced directives allow active anesthesia to be carried out if the client is unable to carry care for himself. So the correct answer is B. So much confusion can occur with the client family if he does not have an advanced directives. First of all, let me tell something about advanced directives. So advanced directives are written instruction recognized under the state law that are related to the provisions of care a person wishes to have when he or she cannot make decision for themselves, like living will or durable power of attorney or advanced care medical directives. What is living will? So prepared by a competent adult and gives the healthcare directions in case when that person is unable to make a decision on their own. We give the living will. And durable power of attorney or healthcare proxy document that specify who will make your healthcare decision if you cannot. And advanced care medical directives, it is a competent client consult with the healthcare provider and specifics the kind of medical care they do or do not want in a specific scenario. So as I told you, answer is B, right? So to decrease the potential for some, let me recap it. Answer is B because an advanced directives allow the client to make known his wishes regarding care if he becomes unable to act on his own. Much confusion regarding life-saving measure can occur if the client does not have an advanced directives. Answer A, C, and D are incorrect because the nurse does not need to know about the funeral plan and cannot make decision for the client. Active anesthesia is illegal in most states in the United States. So answer D is not correct. And next questions. A client who has chosen to the breastfeed tell the nurse that her nipples become very sore while she was breastfeeding her older child. Which measure will help her to avoid soreness of the nipple? Number A, feeding the baby during the first 48 hours after delivery. Number B, breaking suction by placing a finger between the baby's mouth and the uh, breast when she terminates the feeding. C, apply hot, moist salt to the breast several times per day. Number D, wearing a supporting bra. So the correct answer is number B, right? So the suctioning by placing a finger between the baby's mouth and the breast when she terminates the feeding. So to reduce the potential for soreness of the nipple, the client should be touched to break the suction between removing the babies from the breast. So answer A is incorrect because feeding the baby during first 48 hours after delivery will provide the colostrum, but will not help soreness of the nipple. Answer C and D are incorrect because applying hot, moist soap several times a day might cause the burning of the breast and causing further drying. And wearing a supporting bra will help with engagement, but will not help the soreness of the nipple. And next question goes, the nurse is performing an assessment of an elderly client with a total hip repair. Based on assessment, the nurse decides to the medication client with analgesics, which finding most likely prompt the nurse to decide admin analgesic. So key point here, my patient is the elderly client and my patient has a total hip repairment. I need to assessment because patient decided medication analgesic means pain medication, which finding most likely, right? Decide to admin analgesic. So out of 4, which is the answer? Number A, the client blood pressure 130/86. Number B, the client is unable to concentrate. Number C, the client pupil are dilated. And number D, the client grimace during the care. So which finding most likely from the nurse to decide admin analgesic? So out of 4, the answer D is my answer. Why D? Because facial appearance or facial grimace is an indicator of the pain, right? If I too much pain, it reflects on my face. The blood pressure, the answer number A is within the normal limit. So it is not a problem. The client inability to concentrate and dilate the pupil are stated in answer B and C may be related to the anesthesia that he received during total hip repairment surgical operation, not related here. And next questions goes, in obstetrical client decide to have an epidural anesthesia to relieve the pain during the labor. Following administration of anesthesia, the nurse should monitor the client for what? Seizure, postural hypertension, respiratory distress, and hematuria. So what is your answer? So keep it note, patient need epidural anesthesia. During admin anesthesia, what should monitor the client? Correct answer is number C, respiratory depression. Why? Epidural anesthesia involve injecting an anesthetics into the epidural space. If anesthetics raise above the respiratory center, the client will have impaired the breathing. Thus, monitoring for respiratory depression is necessary. So answer A, seizure activity is not likely after an epidural anesthesia, very unlikely, even not common. So answer B, postural hypertension is not likely. And answer D, hematuria is not related to the epidural anesthesia. Hematuria means blood mixed in urine. So next question, the nurse is assessment the client admin for possible oral cancer. The nurse admin identifies which of the following to be late occurring symptoms of the oral cancer. So number A, they said warmth, number B, water, number C, pain, and number D, ulcer with flat edge. So answer C is correct, right? So pain is the last sign of oral cancer. So assessment the client possible oral cancer. Identify which following to be late, not early sign, later sign, occurred symptoms on oral cancer. This is pain. So answer A, answer B, and answer D are incorrect because a feeling of oath, odor, or flat ulcer in the mouth are all elderly occurs in oral ulcer, but it is called late sign. And next question here, the nurse understand that the diagnosis of oral cancer is confirmed with. So what are the confirmatory sign of oral ulcer? Diagnostic. Number A, biopsy. Number B, gram strain. Number C, oral culture. And number D, oral washing for cytology. So diagnosis of oral cancer confirmed always by biopsy. So the best diagnostic tools for cancer is the biopsy. Other assessment, including checking the lymph node, is also important, right? But confirmation is biopsy. Answer B, C, and D will not confirm a diagnosis of oral cancer. And here, the nurse is caring for a patient following removal of a large posterior oral lesion. The priority nursing measure would be, so maintain a patient's airway, B, perform meticulous oral care every 2 hours. Number C, ensure that incision R is kept as dry as possible. And number D, assessment the client frequently for the pain. The correct answer, maintain the patient airway, right? This is very important. So maintaining a patient's airway is a paramount in the post-operative period. This is the first priorities. Checking the airway and see the breathing is okay or not. So this is the priorities of nursing care. Answer B, C, and D are applicable, but are not the priorities. Next question. The registered nurse is conducting an in-service for colleagues on the subject of peptic ulcer. So peptic ulcer is the key point here. The nurse would be correct in identifying which of the following are the causative organism or factor for peptic ulcer, right? So, the peptic ulcer sometimes causes because of the stress, but one of the organism can cause peptic ulcer. This organism name is Neisseria gonorrhoeae, Haemophilus influenza, Helicobacter pylori, or E. coli. So correct answer is number C. Helicobacter pylori bacteria has been linked to produce peptic ulcer. Answer A, answer B, and answer D are not typically cultured within the stomach or in the duodenum or esophagus. So are not related to the development of peptic ulcer. Neisseria gonorrhoeae can cause gonorrhea. Haemophilus influenza can cause any respiratory tract infection, but E. coli, Escherichia coli can cause urinary tract infection. Helicobacter pylori only can cause peptic ulcer.